Welcome, everybody. Thank you so much for joining this webinar today, which is a special one because this is the first webinar in a series around the state of health in the EU. So a new initiative that we'll talk about later. My name is Ewout van Ginneken and I'm the director of the European Observatory. I'm just introducing this special series of webinars today for you. The state of health, I hope most of you know the state of health, which is a collaboration between the OECD, the Commission, and the European Observatory. And I also assume that many of you know what all the different aspects are. So first is we have the Health at a Glance Europe that OECD carries out. Then we have the country profiles that many of you use and I'm sure you're aware of. We also do policy dialogues in the countries themselves. And we also have a synthesis report, which this year took a slightly different approach with a larger focus on reforms and trends and how countries are responding to emerging challenges. So we really hope that you also will look at this publication, which can be found on all three of our websites. The synthesis report focuses on four topics: prevention, primary care, pharmaceuticals and innovation, as well as digital solutions. And we look at how countries are responding in these areas, what they are doing. And in this particular webinar, we will focus on digital health, a real deep dive in digital health. We've seen that COVID was a real catalyst for all kinds of initiatives in the digital solutions that we see carried out. It was sustained by more funding internationally, by the AI Act, also the European health data space playing a role here. But there are also challenges in implementation and worries about differences in implementation and the disparities between how people use it. So far, only 28%, for example, of people in Europe are using their European health or accessing their electronic health records. Sorry. So in this webinar, we're going to dive deep in these with three speakers from our three organizations. And I'm now giving the floor to the moderators of today, and Dimi, who you already see, and also Erica. So thank you and hope you enjoy this webinar.
Thank you very much, Ewout, for the introduction. Indeed, we are going into a deep dive on digital health in the EU. And of course, as Ewout mentioned, there are a lot of considerations to take into account, with different EU countries having a different starting point for the transformation journey and a lot of similar and some different challenges. So today's journey through the webinar, we will start with Gemma Williams, my colleague at the European Observatory on Health Systems and Policies, who led the work on digital health for the synthesis report and has been working in the technical area for a long time. And she will give us a sense of the situation in the EU. We'll then hear from Eric Sutherland from the OECD, who will talk us through overall challenges and some barriers and enablers for the digital transformation of health systems. And then finally, we will go to Dirk van den Steen from the European Commission, who will walk us through what the Commission is doing to help member states and to drive this transformation forward. So we have quite a rich hour ahead of us. We have my colleague Erica Richardson monitoring the chat room, where we really would like to hear from all of you. And please use the chat room for your comments and your questions. Erica will be keeping an eye and will be feeding back to us later on. So we'll hear from our speakers first, one after the other, and then we will have the opportunity to go into discussion and to reflect on your points from the chat. So from that starting point, Gemma, it is the moment to invite you up to the stage and to pass the floor on to you to give us a sense of what we found in the synthesis report. Yeah, thank you.
Perfect. Thank you, Dimi, and good morning, good afternoon, everybody. I hope you're all keeping far more cool than I am in this intense heat. So as Dimi said, today I'm just going to take some time to summarise the key findings from the synthesis report on digital health. And more specifically, I'm going to look at some of the key trends we see in relation to the digital technologies countries have been implementing in the last few years in order to transform the delivery of healthcare. And while I have the honour of presenting the synthesis report was a huge collaboration across all of our organisations. So in particular, I want to thank my colleague Nicole Mauer, then from the OECD, Gaetan Lafortune, Federico Pratolesi, and of course Eric, who we'll hear from later, and then Petronilla Bogart and Dirk. And that's along with the OBS, OECD and country experts who wrote the country profiles in the first place, and all of the other people from these organisations that sort of helped to write and review this report. So next slide, please, Lucy. So to start, we'll look at how investment in health ICT has increased in recent years. So if we start with the graph on the left, we can see that investment in health ICT has increased by approximately 29% in the EU since 2015. So if we take a closer look at the graph, we can see investment did start to increase slightly after 2018. However, it saw a huge boost in 2020. And that was, of course, due to the COVID-19 pandemic. And sort of during COVID-19, digital technologies became essential to keep health services going. And they showed their pivotal role that they could play in ensuring service continuity, improving patient care, improving staff working conditions, enabling faster and more accurate data-driven decision-making, and strengthening health system resilience. And then if we look at the map on the right, it just sort of shows sort of average investment across the EU. And we can see that investment in 2023 was generally higher in the Nordic countries and some Western European countries than it was elsewhere in the region. Next slide, please, Lucy. So what are countries using this investment for? So what digital technologies are they investing in? So we'll start by looking at electronic health records. So as part of the European health data space, all countries, all member states will need to ensure their population has access to electronic health records, I believe by 2029, but we're going to hear much more about the European health data space later from Dirk, so I won't say too much more there. What we can see, and Evan has already spoiled this, but we can see that 28% of citizens across the EU have access to, sorry, let me start again. So we've seen recent years, there's been rapid progress in the adoption of electronic health records. And at the moment, across all EU member states, Iceland and Norway have established some form of electronic health record access. And in 85% of these countries, 80 to 100% of the population were technically able to access their records. Most countries offer centralised access, although some countries, Ireland, Italy, Spain, Sweden, have adopted a regional approach. And currently, secure access is typically ensured via EU-compliant electronic identification schemes, and they're now in place in 21 countries. And electronic health record access is typically provided through online portals or health apps. So we go through some examples in the synthesis report. So you've got sort of the HSE app in Ireland, we've got Mon Espace Santé in France, we've got My Health in Greece, Sundhed.dk in Denmark. And while the functionalities of these platforms vary, they commonly offer access to e-prescriptions and test results, secure messaging with providers, appointment booking, and the submission of sick leave certificates. Now we get onto the spoiled part. So despite this widespread availability, actual use remains uneven. And in 2024, the share of the population accessing their personal health records online, and we can see this from the chart, ranged from 73% in Finland to just 5% in Germany, and averaging 28% across the entire region. So, and all countries reported education-related disparities in access, with only 17% of people with low education levels using these services, compared to 40% among those with higher education. So this obviously raises a key challenge, because unless these disparities are proactively addressed, access to digital health services risks widening existing health inequalities. So Lucy, next slide, please. So along with electronic health records, countries are investing in a huge range of digital technologies, which are underpinning new health service delivery models. And this transformation is taking across the entire patient journey, from first contact through to monitoring and recovering. And it's also improving population level health management and health system management to improve efficiency. So if we start in the first box, so looking at pre-care and access, we can see that countries are investing in digital triage systems and symptom assessment. So, and these are designed to collect symptoms, prioritize urgency, sort of work out what clinician a patient might want to see, so to direct them to the right service. And as an example, in Greece, they've implemented a unified booking system, which handles approximately 700,000 monthly appointments, but that's planned to rise to 7 million appointments annually. So then we've already spoken about sort of the patient portals that exist, so EHDS, which enable patients to access their health records and access sort of appointment booking systems, etc. If we then move on to the second one, so clinical triage and emergency response. So as an example of emergency response, e-ambulances are becoming common in many countries. So as an example, Estonia have an e-ambulance. And with the e-ambulance in Estonia, emergency crews can instantly retrieve critical information such as blood type, allergies, current medication, and recent treatments. This is all done using a patient's national ID, which supports faster and safer decision-making in urgent situations. Many countries are implementing virtual front door platforms, which are essentially just the digital entry points to a health system that handles access, triage, navigation, and communication. So as an example, sort of Finland are doing this and are quite far along in the process. And they've got a public digital clinic system, which serves 3.3 million residents as the primary first contact option. So you go digital first before you see a clinician. And Austria is trialing something similar. So it's in the early stages of implementation, but they're formalizing their digital before outpatient, before inpatient model. So I'm not going to go through all the points here just because I don't necessarily have the time, but I'll move on to the third point here, which is diagnosis and clinical decision support. So digital imaging has seen a huge rise. One other trend we're seeing is the use of AI as well, in particular to support the reading of digital images. So for example, in Sweden, AI in cancer screening for mammography detected 4% more cases while halving radiologist workloads. Treatment and care delivery. We all know about the huge increase in virtual consultations, the increase in e-prescribing. If we look at monitoring and recovering, one of the huge trends in the region is the shift to hospitals at home, which is coming in. And for example, Portugal's hospital home program treated over 11,500 patients in 2024, and that's planning to be expanded as well. And finally, population health and health system management are being improved by digital tools as well. So for example, Ireland have developed an HSPA framework, which is delivered online. They've got a national outbreak hub as well. Italy's AIFA registries track real-world use of high-cost medicines. Portugal's SNS Centre audits over 3 billion in health claims annually, flagging billing irregularities. So I didn't have much time there, but hopefully I've given sort of a flavour of some of the sort of common trends we're seeing across the region and what countries are doing.
Thank you very much, Gemma, for the range of the possible technologies just highlighted. And I'm sorry we didn't have more time to go into them. I think a lot of really interesting examples. I think also important takeaway from your presentation is all these different component parts that are crucial when we talk about digital transformation, from investment in the baseline technologies to thinking about how we work with data, to electronic health records, to the different digital health applications. As you mentioned, we will hear about especially the access to information is part of the digital decade. So Dirk is going to go into that a little bit later. So we see different initiatives, some converging trends perhaps, but a lot of interesting things to keep an eye on. So a lot of good progress, but still a lot of progress to make. And at this point, I would like to bring in Eric. And Eric, you will talk to us about, well, let's say different challenges and different things to keep in mind as we move forward with digitalization. Potentially also with a little bit more focus on artificial intelligence that we didn't touch as much upon until now. Over to you.
A little bit more focus on artificial intelligence, because it's certainly an area of great import to the work we're trying to do around AI and data and digitalization, it's impossible to unintertwine these things. And in fact, one of the things that I think is really important is to make sure the conversations around data, data enablement, digital infrastructure, and conversations around AI are connected, because we need to learn from our mistakes in the digital age when we didn't have those conversations in a combined way and we invested in technology and we neglected the data asset, and thereby we can't actually realize value from the data that we've collected, which is the big reason why the European health data space is such an important initiative for the EU, which again, so all sorts of spoilers here. Dirk will talk about that later on. What I really wanted to talk about today is just provide a bit of context for why the topic of AI and digitalization of health is so hard, and what some findings we've done around our own review of the European Union, and some interesting insights that came out of a recent conference we did in Madrid. So, the real challenge in health is that we're trying to balance three forces at the same time. We're trying to make sure that we're respecting the market that wants to move fast. We're respecting the needs of health providers, the good old Hippocratic Oath, first do no harm, and also the needs of the public, making sure that everyone is able to receive the benefits of the innovations we're creating in an effective way. And so when we put these three forces together, we learn that what we have to do is scale to everyone fast, respecting the market, while doing no harm. And that's really the mantra that we've been having at the OECD and working with partners in the last while. How do we find the sweet spot of policy and enablement and action that allows us to scale fast while doing no harm? With that in mind, one of the things we did last year, we did our own review of AI in Europe that was sponsored by the Commission. And it won't surprise anyone that many of the key findings that we determined was that we need to be strengthening our health data foundations. Frankly, we have, as I said earlier on, we invested in the technology, we didn't invest in the data. Their data assets are massively fragmented, and the use of data is where value for the system and value for patients and value for providers actually will occur. So we need to be strengthening our health data foundations. Within that, we need to be building awareness and trust in AI, because AI is obviously the direction that health systems globally, despite the massive sell-off that's happening today, that this is the general direction that countries are going. And so how do we make sure that we foster trust? And I'll come back to that in a sec. We also want to make sure that we're upskilling health professionals, because they are the front line. We don't want to be dropping AI in the desk and assuming that we're replacing the health professionals. Is more like the case of Sweden that we just heard about, how use of AI is speeding up people's work days to be able to deliver more effective, more quality services for people on a more effective basis. We also need to be improving measurements of our overall systems. It's amazing to me that what we've done historically, we're really good at measuring the readiness of health systems to adopt new technologies, not so good at measuring the actual usage of technologies, which is frankly where I think the work the European Observatory has been so leading, really starting to measure the use of things like EHRs, the use of various tools and technologies, the booking systems, et cetera. I think that we need to be shifting our focus to those measurements because, as we all know, you can't manage what you don't measure. And so we need to start measuring the things in order to understand them and improve them over time. And obviously, we need to be facilitating the integration of AI innovations, because a big part of the challenge we've had, AI innovations were dropped on doctors' desks, and doctors said, "What the heck is this? I don't want anything to do with it." We need to work with doctors, with providers, with nurses to make sure the AI solutions we're developing are fit for purpose and actually are meeting needs of the front line in their service delivery. So that leads me to a recent work that we did with Madrid. One of the things, so we gathered 140 experts together really to talk about what would experts say, where we should be focusing our efforts to enable the effective scale of artificial intelligence in health. Interestingly, one of the things we noted through this work in a report that we published back in March is that there are 7 countries, in the OECD, most of which are in Europe, that have specific strategies at the intersection of AI and health. And many of these strategies really reflect many of the trends that we identified through the conference. The first trend that I will call out, and we need to really shift our thinking to health is no longer beginning its journey with a patient meeting with a doctor. Health now begins with patient meeting with their cell phone. 35% of people report using AI for health purposes in a number of different ways, but this is part of an Edelman Trust report that came out back about 2 months ago. And it's really both surprising, maybe not surprising, but it's really quantifying that this is a trend that has happened. And frankly, that 35% number is not going to go down. It is only going up. And we need to be really thinking about how that impacts our health systems. Within that, we need to reflect that trust is a central challenge. We can develop all the tools and technologies we want. If the people who are going to use the tools don't understand it, don't trust it, don't know how to work with it, don't have the skills to work with it, then frankly, we are going to be at a real challenge. So we need to be fostering the right upskilling and also the right down requirement of our technologies to make sure that we're meeting people with where they're at with their uses of AI. We're also at a point, importantly, where our inaction, our fear around the use of AI is causing harm. We need to be really thinking about we need to not be thinking about, do we use AI or not? The answer is we are using AI. We're using our health data. How do we do so safely? So that is a different mental shift that our policymakers need to be making in order to actually foster the use of these tools. Within that, we need to be defining that scale is success. We are great at pilots. We're horrible at scale. So what we really need to do is we need to incentivize scale. And that ties to our economic and financial structures, making sure that we have a good understanding of the economics of AI, as well as the financial incentives to actually use and scale AI systems. And the last thing I'll call out here, which again, I've said previously, and again, it's actually a nice segue to the next section, we need to be strengthening our data and digital foundations, both within Europe and across the OECD. Frankly, the future rests on our use of health data. We need to be making it more effective on a go-forward basis. And I'm really thrilled with this report we have from the observatory. I'm really thrilled with Europe's leadership around the European health data space. And I think we really need to be focusing on that and making sure it's successful on a go-forward basis. So with that, I turn it back to you, Demi.
Thank you very much, Eric. Don't put the slides down yet. Okay, too late. We'll make sure to put that's fine. We'll make sure to put the links in the chat for the reports that has been also requested, I see, from our participants. Many thanks. I think the bottom line, like putting the spotlight on governance, is really important, and the understanding also. I like the way that you put it. That basically nowadays the journey in the health system starts with people and their phones or their tablets or whatever it is. The interactions change, and we must change as well. I think one of the key points that you bring up is involving people, whether that is the service providers or that is the public, in how these things are developed or implemented is absolutely key for scale. And this is something that we are also, as you are, keeping an eye on and trying to think through how to move forward. And as you said very well at the end, this understanding of data as the absolute foundation for providing the type of health and healthcare we want to have in the future brings us very nicely to the next contribution, which is from Dirk, who will talk to us about how what the EU is doing to support its member states on that transformation journey. So Dirk, over to you. Eric and I will disappear.
Thank you very much, Demi. Thank you for having us on behalf of the European Commission. So I am Dirk van der Steen, head of unit of Santé C3, which is the unit that deals also with state of health in the EU and European semester. Some of the slides I'll be using today, they're also received courtesy by my colleagues from the Digital Health Unit that today, actually, as we speak, are also with member states talking and negotiating about further progress on the European health data space. First slide, please. Previous speakers already mentioned the European health data space. I will just do a quick recap of what are its main components. But first, let me explain a bit what is the overall background. We've already seen indeed that there has been a huge impetus uptake of e-health tools following the pandemic. And we see this also confirmed in what is technically deployed, what is now available at member state level. We also see this when we look, for instance, at the investment flows that go into e-health at national level. You see, I think on an annual basis, if you compare pre and post COVID, there's a 30% increase. The European health data space proposal as such reached its political agreement March 24. And currently, to give you again a bit of the high-level state of play, it's in the first phase, which means that until March 27, a lot of implementing acts need to be adopted. So a lot of the legal nuts and bolts that are required. And then in the second stage, which would be between March 27 and March 29, we would actually see the gradual deployment at national level, and then everything should be in full swing as of March 29. Now, what does it cover, the European health data space? I mean, many, many things, and I will not try to cover all of them, but just the essentials. So one, the idea is that we regulate the primary use, so basically the use of data for the delivery of healthcare, which basically means EU level cooperation on what is in the patient record, what is in the e-prescribing record, what do you need for dispensation, medical imagery, lab tests. So to have all of this in an electronic health record, and also to have it interoperable and be able to cross borders. And that, of course, means that we also have requirements for electronic health record systems at the EU level, also with CE marking and so forth. And the requirements would mainly focus on two big components for the electronic health records. That is, one, the interoperability within the EU, notably also because of the cross-border angle, of course, when we talk from the perspective of the Commission, and also the logging, so the historical background. And then an important other component is also the secondary use. So there we will have rules that determine how we will use all these data collected for primary use, which is the data we need for actually supplying the healthcare service. How can we also use it for research and public interest? So who is responsible? What are the rules? How will we go about this? Next slide, please. Also, another important factor at the EU level in driving forward and accelerating the digitalization of health systems, it's of course the funding side, and it goes hand in hand with the European health data space. And I would like to mention two recent developments there. They have to do with the recommendations, country-specific recommendations that were adopted 3rd of June under the European semester. And then just last week, also country recommendations that were adopted under the Digital Decade. And these recommendations, I selected only those, by the way, for the European semester. In total, we count 16 that address health system reform. 2 where we have an explicit reference on digitalization and e-health, as you can see on the slide, can be in function of efficiencies. Fiscal sustainability can also be, as is the case for Croatia, overall request to invest more in e-health. But you should also be aware that next to these two, there are also 6 countries where the recitals accompanying the recommendations also refer to e-health digitalization. Then there is a host of 8 recommendations that were adopted last week under the Digital Decade. And there you clearly see the focus on electronic health records, which is, of course, to support the European health data space. You also see mention of AI, thinking of Eric's presentation. Now, these two processes and the timing of the recommendations is quite key, because the Commission put forward its proposal last year for the next multi-annual financial framework. And part of the next multi-annual financial framework, which is the 7-year period from 28 to 34 on how to spend the EU budget. Part of this concerns the so-called national and regional partnership plans. And these national and regional partnership plans, for a total of some 770 billion in today's value of the euro, they would have to address, among other challenges that were identified in the European semester, including in the recommendations, and also take into account the recommendations on the digital decade. So there you see how all these components interact. On the one hand, we have the regulatory framework, which is progressing. On the other hand, we have the EU level budget. And in this case, how it interacts with recommendations and the forthcoming national and regional partnership plans from the member states. I should also say that under the European semester, we have 27 country reports, and each country report, in fact, has a thematic health and health systems annex. So that means that e-health sort of more or less is mentioned for every country under the European semester. So I think those were the two main elements I would like to bring to your attention today. As regards EU-level relevant initiatives to further accelerate digitalization of health systems. And I would also like to end with a little shout out under the State of Health in the EU process. We're in that year of the edition of the cycle where we have the Health at a Glance report. Probably it will be end of the year. And this year we have a thematic chapter also dedicated to digitalization of health systems. Thank you very much. Over to you, Dimi.
Thank you, Dirk, for already also promoting the next webinar we're going to be having on that once we have, of course, the new report. So thank you very much for this. I think a really, really enlightening succession of contributions. And Gemma and Eric, perhaps you might want to come back onto the stage so we can see you. We saw and Erica, of course, as well. And Erica, while you are trying to summarize the very lively chat, and a big thanks to people who are basically doing our job for us by pasting in links of their own accord. Let me just say, I really appreciate also the continuity in the contributions that we saw. So we saw the importance of investment. We saw the importance of investing in data. We saw the importance of investing in working with people, which also entails, of course, building up the right skills among different stakeholder groups. And also now at the end, how we can understand the overall context from the EU in that respect, both on the regulatory side, but also, if I can put it a little bit lightly, on the carrots side of things. So investment is possible, but obviously you need to do it in a way that makes sense. So I think a lot of that is reflected in the questions in the chat. So if you want to give us a first glimpse of what's going on, that would be great.
Hello, everyone. Thank you very much for your questions. Yes, a very lively chat. People sharing lots of resources, which is fantastic. Please do carry on doing that. Some quite technical questions coming in as well, but I'm going to try and broaden them out a bit. So one of the questions is around digital skills for health workforce, and what should we be doing to build the digital skills of the health workforce? Another one is on AI, quite a lot of questions about AI, because it's such a fast moving area. What are the key challenges we're facing in developing sort of national AI strategies? And what can we do to sort of overcome them? And another one is more about sort of maybe digital security. With AI, most of the developments are coming from the US and China. So what should we be thinking about in Europe, maybe to become to reduce that dependence on the import of technology? I'm going to stop there for now, but jump back into the chat because there are more questions coming in.
Thank you, Erica. Very, very clear. And perhaps we tackle the first one first. I think that was something that came through across the presentations, the importance of skills and upskilling. And I don't know, perhaps Gemma, if you would like to come in on this one. You've been doing a lot of work in that area as well.
Yes, so I have. So basically, we've been working on the Be Well project for the last 4 years, which is actually just coming to an end. But Be Well looked at sort of how best to upskill, reskill the health and care workforce in terms of digital and green skills. And throughout the project, I mean, obviously I'm talking generally, this sort of varies across countries, because as Dimi, you said at the beginning, countries are very different stages of their digital health development. Some workforces are much further along in the digital skills they have than others. But I think on a whole, what we saw from the project is in every single country, there are still major gaps in terms of the digital skills that health and care workers have. And obviously, this limits the extent to which we can get all of the value out of the digital technologies that we should be getting. So sort of even in some countries that are really far along, have implemented loads of technologies, they're not necessarily changing care processes in the way they should because the healthcare workers can't use them properly. So it's a really fundamental thing is that countries do put lots of investment into improving digital skills amongst their health workforce. And sort of one of the key findings we found is sort of perhaps there were more education and training courses available for doctors and other healthcare workers. So that needs to be improved on. Most of the courses were available in English, and other countries, sort of health workers in other countries really felt left behind because there weren't courses available in their national languages. Although the EU has funded lots of projects, including Be Well, who have now developed courses in different languages to try and address that gap. Lots of countries haven't yet developed competency frameworks for sort of the digital skills and competencies that health workers would need in their specific context and for their specific roles. So that's sort of something that the country needs to look at. But basically, we have written a policy brief and we've sort of outlined all of the sort of challenges countries are facing and how they can overcome those challenges, which I recommend everyone goes away to read. And I think someone has put it in the chat. I think Erica and Stefan have put links in the chat.
Thank you, Gemma. Before going to our other panelists, can I challenge you on this a little bit? Because I think we talk a lot about how digitalization, AI are good tools to reduce the burden on the workforce, seeing as we have constraints in almost all European countries. I always wonder, like, where will we find the time to actually, have where will the workforce find the time to actually do the training that is required? I think Be Well covers digital skills and green skills. We talk a lot about how important it is to develop skills, but there is a lot of skills to be developed and not necessarily a lot of time to do that in. So how do we factor in this element?
Yeah, I mean, that's a major finding from the project, is that actually being able to undertake education and training for CPD requirements is hugely challenging because of the shortages that all countries are facing, the overwork, the overburden that health workers are experiencing. So, and that was sort of, we did focus group discussions, that was always flagged up in every single country as one of the huge barriers to undertaking, to upskilling. To overcome this, we sort of suggest various things. You can make it sort of mandatory in CPD requirements, but then you have to be able to give time off during working hours to undertake the education and training courses. Obviously, that is on sort of organizations themselves and organizational leadership to make digital upskilling a priority, to make sure they have people in place that can do the training, to make sure they have the funding for it. That itself is shaped by the national level. Correct. So at the national level, are there regulations in place? Is there funding in place for these initiatives? Are there strategies in place to guide the upskilling, reskilling across the country? Et cetera, et cetera. So it's all sort of, we need the national vision sort of feeding down to organizations taking action to then create the conditions where individual healthcare workers can undertake upskilling and skilling initiatives.
Thank you. This is exactly the point, right? That we need different levels to work also together in that sense. Thank you for that. Eric, I see your hand up, so over to you.
Yeah, so I wanted to make just a point that upskilling is not exclusive to the frontline doctors and nurses. We need to upskill our policymakers, our bureaucrats, correct, because frankly, those are the people who are writing the things, and they're writing it based on the back of magazines as opposed to real factual knowledge about what it can do. So we really do need to not shift our focus, but we need to incorporate a focus about upskilling the broader health system in addition to the front line. I also think that and this ties more to the role of the public, I think one of the things we need to down require what skills you actually have. And so I think of it as like the public, when we talk about we need to increase health literacy and AI literacy and digital literacy and data literacy amongst the public, frankly, the public are saying what the heck, you're expecting me to do all this? I barely have a grade 8 education. So it is impossible for us to expect the public to elevate everything to all of these levels. So we need to consciously at the same time think about how to down require the engagement with the AI systems. We do need enough for them to be able to trust, because scaling only happens at the speed of trust. But we can't assume that everybody's going to be, coding or writing long scripts. But so what is the minimum that they need to do, and how do we make the system simple enough to use so that way the public and providers can use those systems safely?
Thank you. Really, really important point, I think, also when we think about scaling, not just upscaling. Dirk, come to you.
Thank you very much. Very interesting question. So I wanted to talk about Be Well, but Gemma stole my thunder.
Yes.
But this is a prime example indeed of digital skills and upskilling at the EU level of how it's supported. But at the same time, what we notice also, of course, is that these digital skills, they pop up everywhere. For instance, in the HEROES joint action on workforce planning, because I take the point that we need the time to be trained, being the healthcare staff. But at the end of the day, we also hope it will augment and support our healthcare workforce to basically mitigate some of the shortages, the 1.2 million in the EU in terms of nurses and physicians. So that is also an example of how the topic is not indirectly will also pop up everywhere. I heard the question about the cybersecurity as well, I believe. So there at EU level, January, and by the way, I forgot to mention also for the Digital Decade, my big thanks to the colleagues from DG Connect, of course. And for instance, also with colleagues from DG Connect, and we have also a dedicated agency, ENISA, for cybersecurity in the EU. There was adopted in January 25 an action plan, cybersecurity, hospitals and healthcare providers. And you also see, for instance, and this is then the interaction between what can be done at national level and what can be done at EU level. At the EU level, you see also in the proposed European Competitiveness Fund, but then under the so-called digital policy window, not under the health, biotech, agriculture, and bioeconomy policy window, but digital, you also see cybersecurity. So basically going hand in hand with what is then the complement, the national and regional partnership plans, which were more about spending at really the national level. So this as a quick reaction to the questions. Thank you very much.
Thank you very much, Dirk. I don't know if Gemma or Eric want to come in on this issue of security and the relations with where the current activity lies. We also had this point about why it is so challenging to have an AI strategy, or why we see more than we do. So I don't know if any of you want to come in here. I think yes, Eric, please.
Yeah, sure. No, because one of the things I think of digital security as a pervasive problem, but when we talk about these emerging technologies like AI, we need to think about them as today's emerging technology. There is going to be a new emerging technology that's going to come up in a year or 2, 3 years, and other emerging technologies after that. So we need to reorient our thinking that we're handling this wave, but there are going to be future waves. But through all the waves, cybersecurity risks are going to be present. So how do we orient our thinking to make sure that we're not dealing with cybersecurity threats today, we're dealing with cybersecurity threats in the future? Because, for example, with quantum computing, which has double the power minimum of the current computing capacity, effectively the data storage today with the current encryption keys will be able to be easily broken once we actually get to quantum computing. So what do you need to do today to protect the data, given the threats that are going to exist in the future? So we need to start thinking about that. That is also very, I would say that has deep implications, but it's one of the things that we need to start thinking, are not about how do we deal with today's problems, about how do we deal with tomorrow's problems.
Thank you. And I think that brings me to one point, which is we think about today and we think about tomorrow. at the same time. We don't wait to think about tomorrow when tomorrow actually arrives. And I will link that to the question, to the topic and the question about skills that we had before we go back to Erica for more questions, because obviously we also want to make sure that we equip the workforce of today, but we want to equip the workforce of tomorrow as well. And just linking into what Gemma was talking about with building in all of that in curricula for the professionals that will come in the future is quite important. And Eric, picking up your point from the chat, in case participants have not seen it, is also this idea of new professional roles that have to do with actually supporting all of that moving forward. So that's also quite an important component. A lot of really brilliant insights from this first round. Erica, there's more. It keeps coming. We can see it. So give us a second round of questions, please.
Okay, so yeah, it's been a lively chat. One of the questions is very much around the barriers to data sharing, which seem to be more legal and ethical rather than sort of practical. So what can we do to sort of facilitate the secondary use of electronic health record data sort of within the European health data space, but maybe also beyond? And does anyone have a good example of such secondary use that they would like to put forward as something that, you know, why are we doing this sort of thing? So yeah, yeah, I'm going to leave it there for now and jump back into the chat, if that's all right.
Thank you, Erica. So good examples of secondary use and supporting secondary use. I think we can, I mean, for those who were involved in that or monitoring the discussion around the European health data space as it was being passed, I would say that was very obviously an issue that had a lot of discussion around it. So I don't know if any of our panelists want to come in. The other thing that I would be interested in, and it links with this issue of examples of the secondary use, is also this, perhaps going back to the synthesis report and what you were talking about, Gemma, in the keynote, and we didn't give you enough time to do it properly. Like if we have good examples of countries doing specific things at scale that work very well already, that are different from other countries, I think that would be really, really interesting to highlight. So 2 points: secondary use of health data, and then perhaps this idea of at scale solutions that work well. Eric, I saw a physical hand, and you unmuted yourself, so I'm taking 2 signals. Perfect. Go for it.
Close enough. Close enough. So sadly, so last year we published a report on the legal basis of secondary use. I just put it into the chat. And there are 3 main findings: is that a lot of the problem of the challenges that Europe has is that we rest the decisions about secondary uses of data based on whether or not it's in the public interest or not. If it's not defined, then we define that we need express consent. Obviously, the EHDS is going to be an opt-out model, which is way better. But even then, resting things, uses of public interest is fine if you have a clear definition of what public interest is. We found exactly 0 countries that has a good definition to operationalize decisions in that way. So that feels like one of the major challenges. It's actually something my colleagues in the OECD are actually looking at from data-free flows perspective. But I'll give you the example, which is not European, from Canada, where they've realized this problem around data enablement, that across data supply chains, no one is accountable for the use and enablement of data. Everyone is accountable for the protection of data. No one is accountable to protect the value in the data. And so what they were introducing by agreement of health ministers last September, was they're going to be rolling out a program around national health data stewardship. So stewards are going to be the role that is the countervailing force against the protection that will force the balance between protection and use. But the stewards will champion the use of data and the enablement of data while the privacy officers are ensuring its protection at the same time. So I think that is interesting. It's similar to the National Data Guardian that's in the UK. They have a National Data Commissioner in Australia. But it's one of the things that I think Europe can learn is that without an accountability for who is accountable to ensure the use and value of data are created, if nobody is accountable, then you're for sure not going to get any value out of it, even when the European health data space is in place.
Okay, so this is really useful. I think it also speaks to some of the additional questions that I see keep coming up at the bottom of the chat on obligations to report back findings, for example, from secondary use from the European Health Data Space. And I see Dirk is already waiting to be heard on this. Over to you, Dirk.
Thank you. First, I would say still for the AI strategy, I didn't want to forget the apply
Good.
AI strategy from October last year. Which also the communication from the Commission, which also links into healthcare and not just discovery of new compounds in medicine development, but also healthcare providers, screening centers, diagnostics, and so forth. So would be terribly amiss not mentioning this. Then on the secondary use, it seems we need a good regulatory framework. Seems we need to put out all the implementing acts, which we're doing. As said, I'm not the expert on this. And there are fiendlessly difficult details there, such as the tariff to charge and so forth and so forth. So it's lots of nuts and bolts. But in terms of examples, I think, for instance, with the Health System Performance Assessment Expert Group, we had a report out on low-value care. And I think there, for steering the overall governance and ensuring cost-effectiveness within the health system, there were, for instance, regional variations in care practices that come to mind, for which I think at least a few countries that I know have been doing this for decades already, using billing data and ICD codes and what have you. But this is just already one example, and the idea could also be to sniff out underuse. Optimal use does not, it can sometimes mean underuse as well. So there's already a clear example. Thank you very much.
Thank you, Dirk. And I think this is really, really important, how everything links together. And when we talk about health system performance assessment, and we had the good fortune of working with the expert group on the low value care report a couple of years ago, this is a really important understanding of what the secondary use of data can do for us, not just in the field of research traditionally that colleagues would understand perhaps more on the clinical side, but also at the health system level. That's really important. So thank you for that. I think we have a couple of minutes. We don't have a time for another round. I don't know, Gemma, if you want to come in on any of the previous, my apologies, there's a lot of noise. If you want to come in on any of the previous points before we move to the closing.
Yeah, I mean, I think Eric and Dirk have really sort of covered the main points, but this is, I mean, this is a huge challenge. The sort of, ethical use of health data is been going on for a long time. So I think back even before COVID, so back in 2019, we wrote a policy brief on genomics. So the use of health data coming from genomics. And sort of back then, it was sort of a bit of a burgeoning field. It sort of expanded massively. But even back then, countries were taking sort of initiatives to try and protect, safeguard this data, but also make sure it is used. So I think that's a key point. We need to make sure if it's there, I think we have an ethical responsibility to use it to try and improve patient outcomes. So I don't know, Erica, maybe if you can quickly, you might not be able to because it was so long ago, find that policy brief, but sort of we have some really good examples of what the UK were doing, particularly in respect to the biobank and what the US as well were doing to sort of safeguard that kind of data and make sure it was used appropriately. And also sort of in terms of, I think another one of the points, it goes back to the skills of the clinicians as well, to be able to know how to use this data ethically, responsibly, under what circumstances and in what ways. And I think that's sort of potentially underestimated, because if those skills are not in place, then they are sort of primary drivers of this data in many cases. So we need to make sure that is sort of looked at as well.
Yeah, and I think that links back to the very start of your presentation, Gemma, doesn't it? That, one part is making sure the infrastructure in there. The second part is making sure we have the right data. It links to what Eric was saying before about investing in data as well. And then the next part, of course, is actually making the best possible use of that. Ethically and with a strategic approach. I come back to all of three of you. If you have any last thoughts that you haven't shared that you would like to share, now would be the moment to do that. I apologize to all of our colleagues in the chat who posted questions for which we won't have time, unfortunately, but we have seen them and we monitor also and we take them with us. Looking at Eric and Dirk, if there's anything you want to share. Yes, Eric.
I think that it's really, we are at a point where this is an inflection, And we need to start thinking about what does the future look like and starting to move ourselves with gravity toward the future as opposed to be grounding ourselves in the past. And so I think thinking about what the use cases are, how frankly health will feel within the next 2, 3, 4 years, I think will help make sure that we are investing in the right tools and technologies and the use cases that actually provide the best benefit for everyone.
Thank you. Point well taken. Dirk, any final words?
Yes, thank you. So basically, our starting point is very positive. A lot is technically possible. For that, however, we know also that not just the regulatory frameworks and of course everything should be interoperable, but also the right systems and incentives should be in place. So it's also about governance, and that would be very timely because of the shortage. So we really need to have this kind of solution. So we all have a very valid, well understood interest to making this possible. At the same time, when we were talking before about health literacy and how it was a barrier because of the medical jargon and understanding probability and sometimes also understanding financial coverage schemes in many member states, now we're also adding a digital layer. So we know the opportunity, we know the possibility, and we know the conditions that need to be met to make it a success story. Thank you very much.
Thank you very much, Dirk. And all of that, we take it in a forward-looking way, just as Eric was saying. With that, I think we bring the panel to a close, and I pass it back to Ewout and to Gemma, I believe, to close us. Thank you very much to everybody.
Gemma, I can please go first.
Yeah, I'm going to say two things. So I think someone was asking for a specific country example for sort of an act governing secondary use of health data. And I think Finland is a good country to look at there. So I believe they have an act in place governing the secondary data use from health and social data. That's one thing. I always like to bring, when we talk about digital technologies, I think it can come across as if we're sort of talking about technologies and implementing them and making everything shiny and new. I always like to bring us back and just say, we only talk about digital technologies because we are talking about improving the health of patients, improving population health, improving work-life balance of healthcare professionals. So I just always like to bring it back to people and just say, it's really important that we do implement technologies where they are of value to people and to health systems. And we do need to be future looking, but always keeping in mind that these technologies, they're not the thing we're interested in. The thing we're interested in are the people. So that would be my final point.
Okay, then I'll close it here and want to thank, first of all the presenters for their insights, but also actually you, the viewers, the audience, because this has been an amazing chat box to watch with so many links shared. That's exactly what we would like to see. And that makes it so worthwhile. And we'll make sure that we can share this somehow, or that you manage to copy all these important links that you posted, that we posted, that our colleagues posted. Also, thank you for sticking with us until the end, although it's boiling hot outside. And then one less nice message that unfortunately we're going to take a summer break now. And seeing the numbers that we had today, maybe that's a bad decision because you came with so many. But we'll take a summer break, and we hope to see you back again after summer to join webinars on State of Health, but also other webinars that we organize. So keep your eyes peeled for the program, and we'll hope to see you after summer break. And all, please have a nice break and a relaxing time. See you next after summer. Thank you. Bye.